If you are an elderly man and you masturbate, I need you to stop scrolling and listen to this, because what I am about to reveal could permanently change the way you think about your body, your prostate, and your performance. Here is the reality. Most men over 50 do this secretly, not physically, but emotionally. You may have already questioned, is this still beneficial at my age? Am I harming myself? That is exactly why my erections are no longer the same as they used to be. And the most serious part is that no one talks about this. Not your doctor, not your friends, not even your partner. But I do, because after examining the science, consulting urologists, and listening to thousands of men like you, I can tell you this. Masturbating after age 60 is not only acceptable, when properly executed, it is one of the most powerful tools you have to preserve sexual health, hormonal balance, and longevity. However, when done incorrectly, it can silently sabotage everything. Therefore, today I will clarify everything. 10 surprising benefits confirmed by science, 10 hidden risks you need to avoid, and the difference between a practice that heals you and one that harms you. Let's start with the benefits, because you deserve to know what you're doing right. Benefit number 1, the penile gym effect. Every time you achieve an erection, you are irrigating the corpora cavernosa, the spongy tissue inside your penis, with oxygen-rich blood. This is not just pleasure, it is physiotherapy. It preserves elastic tissue, flexible vessels, and your erectile strength intact as you age. Benefit number 2, prostate cleansing. This is huge. Harvard researchers followed over 30,000 men and discovered that those who ejaculated more frequently had a significantly lower risk of prostate cancer. Why? Because regular ejaculation eliminates toxins, old cells, and potentially harmful buildup in the prostate ducts. Think of it as a self-cleaning system. Benefit number 3, the power-up of the pelvic floor. Each orgasm causes rhythmic contractions in your pelvic floor muscles, the same muscles that control erections, ejaculation, and bladder function. Keeping these muscles strong is essential to prevent incontinence and maintain performance. Benefit number 4, the cortisol switch. Orgasm causes a significant drop in cortisol, your body's main stress hormone. Lower cortisol means better blood pressure, sharper focus, and reduced anxiety. It's like pressing a reset button for your nervous system. Benefit number 5, the neurochemical cocktail. Dopamine, oxytocin, endorphins. These are the chemicals that provide a feeling of well-being released during orgasm. They improve mood, reduce pain, and create a sense of connection even when you're alone. That's exactly why masturbation can be a natural antidepressant. Benefit number 6, the advantage of self-examination. Regular self-pleasure helps you become intimately familiar with your own body. This awareness is one of the best ways to detect early warning signs. Lumps, unusual pains, changes in sensation that may indicate testicular cancer, Peyronie's disease, or other conditions. Benefit number 7, the sleep sedative. After orgasm, your body releases prolactin and oxytocin, which create a natural sedative effect. Combined with the decrease in cortisol, this helps you fall into a deep and restorative sleep, something that becomes more difficult to achieve as we age. Benefit number 8, the boost of blood flow. Masturbation not only benefits your penis, but also increases circulation throughout the pelvic region, your bladder, prostate, and surrounding muscles. Better blood flow means healthier organs and fewer age-related problems. Benefit number 9, the ejaculatory training ground. If you have difficulties with premature ejaculation, masturbation provides a private and pressure-free space to practice control. Techniques like the stop-start method can be refined here to then be applied with a partner. Benefit number 10, the libido lifesaver. Your brain is your largest sexual organ. By regularly engaging in sexual fantasies and physical arousal, you keep these neural pathways active. This preserves desire, responsiveness, and sexual confidence, even if you don't have a regular partner. Now, this is where most videos stop, but I won't stop, because knowing the benefits is not enough. You need to know the risks, because they are real and more common than you think. Risk number 1, the trap of isolation. When masturbation replaces human connection, it becomes a problem. If you are choosing self-pleasure over intimacy, it's time to ask yourself why. Risk number 2, the effect of skin damage. Excessive friction, insufficient lubrication, and you will create micro-lesions on the skin. This can lead to irritation, inflammation, and infection. The solution: always use a quality water-based lubricant. Risk number 3, the deadly grip syndrome. If you always use the same pressure, rhythm, and technique, your brain becomes conditioned only to that sensation. This makes sex with a partner difficult. The solution: vary your approach, change your grip, experiment. Risk number 4, the erectile dysfunction mask. If you can only get an erection during masturbation but not with a partner, don't ignore it. This could be a sign of heart disease, diabetes, or low testosterone. See a doctor. Risk number 5, posture problems. Masturbating while bent over or sitting on a hard chair can compress the pudendal nerve, leading to numbness or pelvic pain. Lie down, get comfortable. Risk number 6, emotional escape. Using masturbation as your only coping mechanism for stress or boredom can lead to dependency. Develop other tools: exercise, meditation, social connection. Risk number 7, the shame spiral. If guilt consumes you afterward, it's time to reframe. Masturbation is a natural and healthy practice. If you can't get rid of the shame, talk to a sex-positive therapist. Risk number 8, pelvic congestion effect. Ejaculating multiple times a day, every day, can cause a feeling of heaviness or pain in the testicles. Moderation is essential. Listen to your body. Risk number 9, a decline in sperm quality. If you are trying to conceive, ejaculating daily temporarily reduces sperm concentration. For optimal fertility, wait 2 to 5 days between ejaculations. Risk number 10, disconnection from pornography. If you rely on extreme or unrealistic pornography, your brain may lose the ability to connect with real intimacy. Balance visual stimulation with imagination and real memories. So, here's the main point. Masturbation is neither good nor bad. It's a tool. And like any tool, how you use it determines the outcome. Practiced with awareness, moderation, and respect for your body, it is one of your most powerful allies for maintaining vitality, confidence, and sexual health, even into your later years. Now I want to hear from you. What surprised you the most? Do you have any questions? Leave a comment below. Let's keep this conversation going. And if this video was helpful to you, click the like button, subscribe, and turn on notifications so you don't miss the next one. You're not broken, you're evolving, and your best years are still ahead.